Hi everyone, it's Tara Bianca with Be Light Transformative Therapy, and I am so happy to be back with you guys after taking the entire month of May off. It was a really much needed break and I'm so happy I did it, but I'm also happy to be back and reconnecting with all of you. The one quick announcement that I want to make before we jump in today is that my birthday is coming up on June 24th, and I'm really trying to get to 20,000 subscribers before my birthday. So, if you find that you're watching my videos and you get some value out of them, or maybe you know someone who you think might get some value out of my videos, please go ahead and hit that subscribe button. I can't tell you how much that simple act helps to support small YouTube creators like myself. Thank you so much. Okay, so let's jump into our topic for today. Today I want to start to brainstorm with you some breathing strategies for dealing with acute bouts of low back pain. Now, the cool thing about these strategies is that they can also be useful for when you're experiencing digestive discomfort, and they might also be useful when experiencing menstrual cramps. I have a number of ideas that I want to share with you, so in order to make this video not so long, I've decided to break these strategies up into multiple videos. So today will be Breathing for Low Back Pain Part 1. Okay, so for part 1 of this series, we're going to investigate some breathing strategies in a seated position. So in this case, I'm just on my knees, kneeling in a sort of seiza position, but you could easily adapt everything that we're going to do today to being seated in a chair as well. Okay, so to start, we're literally just going to use our thumbs or fingers, whatever is most comfortable for you. And the first muscle we're going to kind of go after is our QL, our quadratus lumborum. So that's one of your deep back muscles, but it's pretty easily accessible. So find your waist crease. You'll feel those hip bones. You can sit right on top of those hip bones. Put your thumbs there and keep following the path of that hip bone back. And eventually you'll feel like, oh, your thumbs run into this very hard muscle, this hard muscle tissue, and it's sort of running vertically, lateral to the spine, right? So that is your QL muscle. And if you do a little side bending back and forth, you can feel it really easily. So I'm just taking both of my thumbs now and I'm just pressing in bilaterally on both sides into those two QL, and I'm just maintaining my inward pressure on them. So I find the muscles. I can turn sideways for you for a moment so you can see it a little bit better. So from the side, again, I'm at my waist crease and I'm just following that hip bone back, so you can see I'm pretty far back, but if I sink in, wow, I really feel like I run into a wall. So that's the QL. And you can see as soon as I press into that and breathe, I get that big Buddha belly, right? Everything starts to relax. So that's what we're looking for. I'm going to face the camera again, face forward again, so then you can see what I'm doing a little bit better. Okay, so I've got my thumbs in my QL, and if you're confused about where you are, just side bend back and forth, and where the waist bends, press in a little bit more with your thumbs. And I assure you, you are going to find that muscle. So now we're just holding our thumbs with inward pressure, and from here with mouth closed, preferably tongue making contact with the roof of the mouth, right behind the top teeth without touching the teeth, we're just going to breathe quietly, softly, gently in and out of our noses. So here we go, keeping that inward pressure on the QL. Taking a couple breaths here and just exploring. I don't know if you can hear on the mic, I'm getting these digestive noises, so already this is starting to help with that digestive discomfort, which I actually have in real time right now. So this is a really good exercise for me to be doing and to be able to give you real-time feedback about how it's working for me. Breathing softly, quietly, gently in and out through the nose, keeping that inward pressure on the muscles of the back. Now, I know all of you are going to say, how should we be breathing? So I'd like you to breathe in and out through your nose for this. I'd like you to keep your breath as quiet as possible. I don't necessarily want to give you a specific cadence, but I'll tell you that the more I sit here and just breathe quietly by myself, the more I'm trying to actively slow down my breathing, and I am thinking about slightly extending my exhale. So for those of you who have been doing a lot of guided breath work with me, something like a 4-6 cadence might be really nice while you're doing this work. So 4 counts in and 6 counts out. Quiet, gentle, easy breathing. And then the other thing that I'm going to say is even though my hands are on my waist, I don't want my shoulders to come up to my ears, right? So when we start to breathe into this upper chest, create a lot of tension through the shoulder girdle area, and start to activate the muscles of our anterior neck, this is when we start to feel a lot of a stress response. We feel more anxious, we feel more nervous, more anxious, more stressed, right? So the one thing I'm going to say is we're really trying to deepen the breath with this work, right? We're trying to get expansion and gentle movement through this area of discomfort. In this case, the low back and the viscera, the organs, the abdominal area and the reproductive area. Okay, so let's get your thumbs back there one more time, and I'm going to stop talking so much. And we're just going to take 2 or 3 breaths here quietly. So pressing in on those back muscles, on those QLs, and breathing in slowly, gently, quietly in through the nose. Letting the belly expand, letting the breath deepen. And exhaling out slowly, gently, quietly through the nose. Letting the belly deflate and relax. Good. Shoulders down away from the ears. Breathing in again. Slowly, gently, quietly in through the nose. Feeling that expansion in the lower part of the body, in the abdominal wall, relaxing the chest, relaxing the throat, relaxing the neck, and exhaling out slowly, gently, quietly. Good. Now we're going to kind of move around this waist crease with our hands. So now you can take sort of the L shape of each finger and just press it into the side wall of the abdomen. And so again, if I went to press down with my hands, I would feel those hip bones right under the palm of my hand. So those 2 ilia, those 2 hip bones. And I can just stay here for a moment and take a couple breaths the same way, slowly, gently, quietly, relaxing the upper body and thinking about extending the exhale. Notice as I expand, my belly really pushes out and gets bigger. And then exhaling slowly, gently, quietly. And a couple more breaths here, just holding the waist crease, pinning it to the hip bones. And maybe one more time. You start to feel that saliva pooling up in your mouth. That's a good sign, starting to activate that parasympathetic nervous system. And exhaling slowly, gently, quietly. I really feel a lot of nice digestive gurgling going on in my belly. Maybe you can hear it too. So that's feeling very satisfying because I am having a lot of digestive discomfort tonight. So this is really good exercise for me, and I hope you're getting a satisfying effect as well. So we're going to take one more point with our thumbs. So we did the QL, we did the waist crease, and now I'm just going to take my thumbs again, and I'm going to come forward a little bit and in. So I'm finding those hip points, right? Those 2 ASIS of the hips, those hip points that stick out in the front of the body. And I'm just wrapping my thumbs around them and falling gently into the soft tissue just inside of those hip points. So now this could be very tender, especially if you're not used to working on this area. You're not trying to go as hard as you can. It's not, more is not better. Harder is not better. Painful is not better. Just be gentle with yourselves. And you're gently, I'm staying up against the bone. So this part of my thumb can feel the bone on the other side. So I'm not really in the abdomen. I'm just scooping out the bone. So I'm just on the inside of either one of those hip points. And I'm pressing back towards my back. And you'll see even my pelvis is kind of going into a posterior pelvic tilt a little bit. I'm going to turn to the side again so you can see it better. Okay, so then the side view here is I just found those hip points, right? Those bones that stick out the front. I wrapped my thumbs around them so that this fleshy part of the thumb is in the soft tissue. It's not on the bone, it's just inside the bone. And I'm just going to press my thumbs into that soft tissue. And as I do that, I let my back kind of curl and relax a little bit so that it can scoop in even more and really sink. And so now the same thing in this position. As I inhale, slowly, gently, and quietly, getting the shoulders down away from the ears, I feel them creeping up. So it's a reminder for me as well. Getting the shoulders down, relaxing the upper body. Inhaling slowly, gently, quietly. Feeling the belly expand, and then exhaling slowly, gently, quietly, trying to extend the exhale. Let's do a couple more breaths like that. Inhaling, I'm just keeping firm inward pressure. And exhaling slowly. And I'm going to say that as I'm breathing, I'm not just feeling the expansion in the abdomen, I'm also thinking about expanding into the low back. I'm feeling some very gentle, subtle movement through the sacrum and the lumbar spine. So the visualization here will really help you to feel that expansion. So really imagining that area of discomfort and thinking about bringing breath to that space. One more breath like this. And exhaling slowly, gently, quietly. Great. So let's just do a quick check-in. How are you feeling? Has anything shifted? So remember, these exercises that I'm going to be showing you throughout this series are really for moments of acute pain. So actively, the low back is hurting. Actively, you're feeling digestive discomfort. Actively, in that moment, you might be feeling menstrual cramps. This is something to experiment with yourself to see if it helps to alleviate some of those acute symptoms. So as I'm going through this right now, I'm really feeling a change in the body. I'm feeling the nervous system starting to relax. I'm feeling the organs starting to relax. And I'm feeling some of that digestive stickiness starting to release. I'm feeling like the viscera are able to move more smoothly, and I'm feeling less uncomfortable. So I would ask the same for you. Just do a quick check-in and see what has shifted in the last 10 minutes or so since we first started working on this. Okay, and then for those of you who maybe for whatever reason don't want to use your hands, maybe you're dealing with some kind of arthritis or your hands hurt or your hands get tired or your nails are too long or whatever it is, I wanted to give you another option as well for doing this exercise. So what might be ideal is if you have one of those stretchy resistance bands that you can tie around your waist and not use your hands at all. And the whole object of that is that resistance band will offer a little biofeedback to your brain to say, okay, brain, please bring the breath down here. Let's focus on expanding here, right? So just increasing awareness around this area of the body where you want to bring breath, where you want to bring gentle movement. Now, I don't have one of those resistance bands on hand, so I'm going to give you another option as well, which is this is just a belt that I took off of my bathrobe. So if you have a nice long belt like this, it could be a yoga strap or a belt that you pull off of something or a scarf or a very thin towel that you can roll up. This will also be useful in this scenario. Okay, so how are we going to use it? We're going to use it in two ways now. We're going to start at the level of the waist, right? So find your waist crease, literally halfway between the rib cage where the ribs end and where the hips begin, right? So the true waist. And I'm going to just get a good grip on this belt. And I'm literally going to pull, okay? I'm going to pull and get it as snug as I can. Now this is giving me a lot of awareness of where I want to bring the breath, where I want to bring gentle movement. It's going to help me to deepen my breath, lower it, focus more on abdominal expansion, but also about breathing into the low back again, right? So here we go. You want to have a good tight grip on the belt, but you want to let your breath win on the inhale. And then you want your hands to win on the exhale. So as I breathe in, I'm keeping tightness here. I'm keeping it taut, but I'm letting my breath win, right? So I'm not letting go of the belt, but I'm not pulling it against my breath either. So as I breathe in, I let the belt win. And as I exhale out, I really cinch down this belt. Okay, I'm going to do it without talking. We're going to do 2 breaths like this so you can see it without any talking. Breathing in and out slowly, gently, quietly through the mouth, trying to relax the shoulders down away from the ears. Good. So I really love that one. I think it's so helpful, especially if we have some amount of dysfunctional breathing, a dysfunctional breathing pattern where we're stuck breathing in our upper chest a lot of the day. This is so helpful to give that cue to your body to say, breathe here. It just really helps to increase awareness, which is awesome. Okay, so the last way that I want to use the belt or the resistance band or whatever you have to tie around your waist or your hips is we're going to drop it down a little bit lower. So now we're really thinking about cinching it around the hips themselves, right? So I'm literally finding those hip points again, and I'm dropping a little bit below them. So really getting low on the hips, low on the pelvis. I'm getting a nice tight grip this time because I'm literally cinching into bone. It's not as much soft tissue, so I have to get a stronger grip with the belt. And I'm going to prop myself up a little bit more just so you can see a little bit better. Okay, so I'm cinching really tight around those hip bones. I'm not in the waist anymore. I'm much lower. I feel a little bit of contact of that belt on my sacrum, that triangular bone at the bottom of my spine. And I also feel it in the lower abs, right above the pubic bone, right? So I'm really pulling on this one. But again, as I inhale, shoulders down, relax the upper body. I'm going to let the breath win, and then on the exhale, I'm going to really, really, really pull. So this one's going to be a little bit more subtle because we're definitely not used to bringing the breath this low down. But if you start to have some awareness there and bring a little gentle movement there, I promise it's going to really help with that pain. And exhaling slowly, gently, quietly. And I'm pulling actively, trying to cinch the belt around my hips. And let's do one more breath like that. So I really feel my lower abs pushing against that belt. I'm letting the breath win, and then I'm exhaling out slowly, gently, quietly. And I'm really pulling the belt. Great job. So again, just pausing for a moment and just scanning through the body. What has shifted? We've been doing this for maybe 15 minutes now. What has shifted since we first began playing around with these different ideas for breathing into the waist, breathing into the low back, breathing into the pelvis and the abdomen? Do you feel a subtle physiological change? Do you feel more comfortable? Do you feel less pain? I know for me, I feel way more comfortable right now. I feel like my digestion is improving, and I actually feel less pain in my back and in my hips. That's all for today. I hope that these few simple strategies in a seated position were useful for you. If you got any relief at all from today's exercises, or if you just have any other feedback or questions, please feel free to leave those in the comments below. I plan to drip out the rest of this Breathing for Low Back Pain series over the next several weeks. So be sure to hit that notification bell and make sure you check back often for more videos. If you like this video, please give it a thumbs up and please subscribe to my channel. I'm trying to hit 20,000 subscribers by my birthday, which is on June 24th. So it would mean the world to me if you would go ahead and hit that subscribe button. Also, if you're looking for a more structured breath program, please make sure you check out my totally free Breath Basics 6-Day Challenge. And if you'd like to have more face time with me, including live monthly Q&As, as well as live guided breath sessions, then please consider joining my private online Be Light community. And lastly, if you'd like to further support the channel, you may do so by either visiting my new Be Light store or by visiting my Buy Me a Coffee page. Thank you so much for watching, and I'll see you next time.